in one of the recordings, we went through the motor examination as part of the International Classification of Spinal Cord Injury. And when we talked about motor scoring, we identified a rule that talks about identifying the motor normal level. And motor normal is considered the most caudal segment of the spinal cord where you have a 3 or a grade of 3 or 4 if the levels above it are all scored a 5. And that sort of rule is an interesting rule, but it sort of has a lot of implications for how you score and ultimately classify people with spinal cord injury. So I thought a visual would be helpful to really describe why that rule is what it is and what is the rationale for how we score that. So we're going to focus on the upper extremity key muscles, and I'm going to draw some spinal segments. We're going to call this C5, C6, C7, C8. Okay. So one of the things that the committee talked about was their rationale or the reason for choosing the key muscles that they chose. And one of the first requirements was that muscle had to have primary innervation by the given spinal level. So let's start with the biceps. The biceps are the key muscle for the C5. They're the myotome for C5. So we're testing the C5 spinal level. So I'm going to draw while the biceps predominantly receive innervation from C5, all of these muscles are receiving innervation from more than one spinal level, which is really, this is the underlying reason why this rule exists. So while most of the innervation is from the C5 spinal level, they're also receiving input from C6, okay? The same is true with the C6 myotome, which is the wrist extensors. So they are the key muscle for C6. They're receiving predominant innervation from the C6 spinal level. However, they're also receiving innervation from the C7 level. If we continue on to the C7 key muscle, that's going to be the triceps. They are receiving predominant innervation from C7, but also receiving input from C8. So if we think about how we score the motor exam, I'm going to draw some motor boxes that you would do on your worksheet. We have 3 levels. So let's hypothetically say we have a grade of 5 for the biceps. We have a grade of 3 for the wrist extensors, and we have a motor grade of 1 for the triceps. If you're going through the score sheet and you're now trying to determine the motor level for that level, we need to figure out what is motor normal. So motor normal is going to be the most caudal segment with normal function. So the most caudal segment with a grade of 3 or 4 if there are 5 directly above it. So on your worksheet, you would go to your motor key boxes. You would start at the top, which is C5. And you would work your way down. So you can see here, we have first a grade of 5, and then we come to a grade of 3. What a grade of 5 in the biceps tells us is that we have normal innervation to the biceps, which means normal function of the C5 and C6 contributions. So when you see a grade of 3 in this box, what we need to think about is what is contributing to that grade of 3. So we know it's not completely normal because it would be a grade of 5 if it was normal. It's considered normal because there's a 5 directly above it. So what we're essentially saying is that some of the innervation is preserved, likely the C6 segment, because there was a C6 innervation to the biceps that was considered normal. So C6 likely isn't the culprit of this person getting a 3 on their motor score. But because the wrist extensors also have contribution from C7, there's potential that this innervation from C6 was normal, but the culprit of the weakness was C7. Because we know that C7 is potentially impaired, that also explains a grade of 1 in the triceps. So both C7 and C8 have some level of impairment, which is contributing to a motor score of 1 in the triceps. So if you see a 3 or a 4 and there's a 5 directly above it, that can be considered motor normal. So your motor level would be that level that has a 3 or a 4. In this situation, it would be C6. If you see a 0, 1, or 2, that is not sufficient and the rule does not follow. So if you see a 0, 1, or 2 with a 5 directly above it, you cannot consider that level normal because likely both levels of innervation are the culprit of that weakness. Hence, they're not considered motor normal. So a complex topic, hopefully a visual helps describe this rule and will help you with your overall classification when you go through the motor scoring.